Breaking news, a $2 billion lawsuit was just filed against.
So I posted that video, and on the video I wrote some text that said, the dose is the problem. I also think the non-discriminatory way that the drug has been used is the problem. But here's the thing. They did tell you. Like, it was in every single research study. It was in all of the information. There were even people on here posting the research articles about the thyroid cancer and the gallbladder dysfunction and all of that, including me, and saying, these are the side effects when the dose is not correct and when the dose is not meant for you. So if you are someone who truly is just now getting on social media and you've never heard any of this and you've never heard any of the arguments against GLP-1 use, okay, maybe you get to be part of that lawsuit. But if you've been on TikTok at all since 2 years ago, they disclosed all of that. They disclosed everything that guy in the video is talking about. And they even advised against people with a history of thyroid cancer using the drug. But people are going after Eli Lilly and Novo Nordisk because that's where the big money is. They're not going after the physician that prescribed the wrong dose. They're not going after the weight loss clinic that indiscriminately prescribed to people who didn't need it or had an eating disorder. They're not going after the person who was like, well, we can't get that one in stock, so we're just going to give you the higher dose. They're not going after the person who wasn't communicating with them about nutrition and exercise while using the drug. But you can even go back and watch commercials from Trulicity or Jardiance, because those are also GLP-1s. And the original Ozempic that came out in 1992 got pulled off the market in 1995, re-released onto the market in 1998, and kind of blew up in 2002. You can go re-watch those commercials, and they talk about those side effects. I mean, the blood clots one is new, but I don't know that they can specifically relate that to GLP-1s. In fact, I would think that you would have to absolutely prove without a doubt that you never received any other shots since the release of any of these drugs to be able to claim that that is a direct causal relationship, because we know that some of the other shots in the last 5 years have caused blood clots. And again, dose and then dose times duration can make the poison. There are people who've been on the original Ozempic at a really, really, really low dose for 15, 20 years with none of these side effects. But they're being dosed to manage their diabetes, not for weight loss. There's research on how these drugs, some of the specific GLP-1s, tirzepatide is one of the ones, that specifically help lower LDL cholesterol while not touching HDL cholesterol and actually improving triglyceride numbers. There's research on how these drugs actually decrease migraines, chronic pain, the headaches that come from here. Oh my gosh, I'm drawing a blank on the name of them. But they're the type of headache that increases the risk of self-harm. Cluster headaches, that's what they're called. It decreases that. There is research on how it decreases intracranial pressure after a stroke, and so helps the brain heal faster. So there's a ton of applications, but also in all of those studies, the doses are way less. I posted another video in response to a question that I got today on a research article that talks specifically about neurogenic and neuromusculoskeletal pain, where GLP-1s have been shown to be effective in decreasing that. Like peptides and chronic pain should be a thing more than opiates in chronic pain. But again, we're ODing people on these. We're not being discriminative in who we use them on and why. And we're not doing the follow-up. I mean, you know, I had a client who had been on Zepbound for 5 years for alcohol addiction, who at 26 got told that she was menopausal at 26. Meanwhile, she's been trying to get pregnant and have a baby. And no one talked to her about the side effects of this medication and the appetite suppression, along with the suppression of the desire for alcohol. And she nutrient depleted herself into a low functioning thyroid and menopause. And simply changing the dose and allowing her to have normal hunger cues, within 3 months we restored a normal monthly cycle for her. We've got to do better. And as the consumer, you have to do better. If you're experiencing not having a bowel movement every day, if you're experiencing nausea still directly after taking your shot, if you're experiencing significant loss of appetite where you don't want to eat 3 meals a day, if you're experiencing appetite that doesn't allow a loss that allows you to get in 90 grams of protein a day, that tells you I don't need to drink any water. You are responsible for communicating that to your physician so your dose can be adjusted, because your dose is then too high. The gallbladder issues, honestly, yeah, it's a problem, and I don't think they talked enough about it, but they did mention it in the pamphlets, because I looked at 4 of them. It's there. That conversation probably should have been highlighted a little bit more. But the reason the gallbladder becomes a problem is because you're releasing fat. That fat has stored toxins in it. Those toxins overwhelm the liver spends its time then detoxing you, as opposed to cleaning bile. So it puts garbage back in the gallbladder, which then calcifies and becomes stones. And their response to gallstones is just take the gallbladder out, it's damaged. They don't do that with kidney stones, but they do it with gallbladder stones. So all of this information was there, and I'm not sure how far this lawsuit will get, but there's a lot of, I think, misplaced blame in this whole game, because I think a lot of the people who had serious side effects were people that were using not an endocrinologist, not someone who was specialized in weight loss, but were using a weight loss clinic. And on every social media platform, there were people talking about the risks, the inherent risks, and how it could be done right and how it could be done wrong. And there was somebody who immediately started teaching a class about it. And even as a layperson, you could take that class and get education. And if you chose not to, I feel like that's not exactly the responsibility of the drug company. Like, this isn't the opioid crisis. This is something where the education pieces and parts were there, the information was there, and people chose to ignore it and are now disappointed with their decision.